So in working with kids with their exercise capacity, constant high intensity can be a little difficult for them to do, but they can do an interval type training fairly well. Short bursts of higher intensity interspersed with lower intensity. So for example, if you're out on the track, you can have the youth run the straightaways and walk the turns, or vice versa. You could have them speed up a little bit for a few minutes, or a few seconds, 30 seconds, 1 minute on some of the cardio equipment. So, kids can tolerate that pretty well. They do tend to recover from their workouts faster than adults. When we get to the aging lectures, we'll talk about, recovery time, and that becomes more and more difficult as you get older. But as you know, kids can improve both their aerobic fitness and their strength. So it is perfectly safe for them to train aerobically. It is perfectly safe for them to train with weights, with resistance training, performing resistance training. And in fact, it's not only safe, it's probably really recommended for them so that they can get all the health benefits that we know about. So we will discuss, so be sure you've really read and you're prepared to talk about some of the issues in the resistance training recommendations for kids. Let's shift base a little bit and talk about congenital heart disease. Now, these are data from the American Heart Association. So there are about 1.3 million Americans with some sort of congenital heart disease that they were born with. Half of these are less than 25 years of age. So about 36,000 births per year. And this is important as we go into the next topics on healthcare reform, because obviously this is very expensive. These are children, infants that are having surgeries oftentimes within hours after they're born, many multiple surgeries over the course of their childhood. So an incredible amount of cost for the families that they have to bear, on top of the emotional pain of having a child with a congenital heart defect. Oftentimes there is no known cause, but there are some conditions that increase risk of congenital heart disease. Genetic syndromes such as Down syndrome, you're probably the most familiar with. That is an abnormality on the 21st chromosome where there's an extra chromosome. Noonan syndrome is a syndrome that is involved with short stature. And then trisomy 18 versus trisomy 21, which is Down syndrome. Trisomy 18 is similar in that the children often have multiple medical problems, including congenital heart defects. And you may recall former presidential candidate Rick Santorum. He has a little girl with trisomy 18, and oftentimes he would have to leave his campaign appearances because she would end up with frequent hospitalizations. Environmental exposures can also lead to congenital heart disease. Certain medications, particularly Accutane, which is used for acne, is strongly associated with risk of congenital heart disease in moms who take it. So women who use Accutane, must not become pregnant. They have to undergo frequent screenings and pregnancy testing because of the, extreme increased risk. Other bipolar anti-seizure medications can also cause increased risk of congenital heart disease. Rubella, German measles, with more and more people not wanting to vaccinate their kids because of the myths involved with the safety of vaccines and the myth of vaccines causing autism, which, there are many, many studies that have indicated that is not the case, but people are still opting out of vaccines, but that can increase risk of communicable diseases such as rubella, German measles, which is associated with congenital heart defects in women who are exposed while they're pregnant. And of course we have the final one, alcohol abuse, street drugs. So the effects of the drugs and alcohol themselves, plus also the lack of nutrition and poor prenatal care for these women.